Hi everyone. Today let us talk about the important topic of anatomy of the middle ear. Anatomy of the middle ear part 2. Okay, part 2. We talked about the roof, we talked about the floor, we talked about the anterior wall, and we talked about the lateral wall, that is the tympanic membrane in the last part of the anatomy of the middle ear. Let us talk about the posterior wall and medial wall. Seriously speaking, when I was studying my MBBS, I really never understood this posterior wall and medial wall of middle ear. This was always a nightmare for me. This is a honest confession. I will try to make it as easy for you guys as possible because now I am an ENT surgeon and I have to operate this part. So believe me, it took me more than 1.5 months to just understand the various relations so that you can go ahead and start doing temporal bone dissection. Okay, it took me that much of time. Considered to be one of the most intricate anatomies of the human body. And the problem, one more problem, is there is so much of anatomic variation in between one human being and the other human being that performing a mastoidectomy is a real challenge. It is one of the challenging and exciting parts of an ENT surgeon. Now coming to posterior wall. Okay, posterior wall. What is posterior wall? Posterior wall is the common wall. Is the common wall between the middle ear and the mastoid. This is the mastoid. This is the middle ear. So what is posterior wall? It is a common wall between the middle ear and the mastoid. Okay. In this we have 7 important structures. Now remember, there are 7 important structures. The first one is the adytus. Adytus is an opening, is nothing but an opening. This attic or this is the whole thing is the middle ear. This is the attic, the upper part of the middle ear, also called the epitympanum. And this attic will lead through the adytus into the antrum. We talked about this. Antrum is the largest hair cell. From there you enter into the mastoid hair cell system. So adytus, this is the posterior wall. Suppose this is the posterior wall. If you are looking at it from the anterior side, the adytus will form the opening at the most superior part of the posterior wall, which is connecting the attic with the mastoid antrum. Okay. So next one we are going to learn about is the pyramid. Pyramid is a projection on the posterior wall from which originates the stapedius muscle. So suppose this is the, you are looking from, this is the pinna, and this is the external auditory canal. You are looking from above. Okay, and there we talked about the annulus, right? We talked about the annulus. Now we make an incision, we elevate the tympanomeatal flap, and now we are in the middle ear cavity. This is the anterior wall, this is the medial wall, and this is the posterior wall. Okay, this is the posterior wall, and here you have the mastoid. So after entering into this, here on the posterior wall, you will see a projection that is coming out. That is called the pyramid. So this is that projection that we are talking about. From the pyramid arises this muscle that is called the stapedius muscle, which goes on to attach to the neck of the stapes, So what does the stapedius muscle do? The stapedius muscle is an important part of stapedial reflex. So whenever there is a loud sound coming into the ear, then it contracts in a fraction of a second, less than a microsecond. It causes contraction, and it prevents those loud sounds or vibrations to enter into the inner ear. This is the inner ear, right? This is the vestibule, and it prevents it to cause damage to the inner ear. So this is the function of the stapedius muscle, and the stapedius muscle is supplied by the 7th nerve. Luckily for us, stapedius S starts for the stapedius muscle, and S starts with the 7th nerve. So you can remember stapedius is supplied by the 7th nerve. That is nothing but a facial nerve. Okay, tensor tympani is supplied by the trigeminal nerve. Tensor tympani T is supplied by T. Here S is supplied by S. So let me just recap again. Pyramid, as we are going from the external auditory canal, we are going through the external auditory canal, we are lifting the tympanic membrane, and after going into this middle ear cavity on the posterior wall, here you have the medial wall, you will see the promontory. The posterior wall, you will see the pyramid from which originates the stapedius muscle, which is attached to the neck of the stapes, and it has an important function in the stapedius reflex, protecting the inner ear from loud sounds. Okay. Now coming to facial nerve. Facial nerve is the big brother of middle ear. Okay, so this is what every ENT surgeon is scared of. Okay, junction of the medial and the posterior wall. So this is the medial wall of the middle ear, and as you said here, medial wall of middle ear. The facial nerve, where in the medial wall of the middle ear, is called the horizontal segment. Okay, and there it turns on to the posterior wall, and this turning is called the second geno. Okay, and it passes vertically downwards to come out through the stylomastoid foramen, and from there it will supply the pes anserinus, where it supplies the muscles of facial expression. So in the posterior wall, it is going vertically downwards in the middle of the posterior wall. This entire thing is the posterior in the middle. It is present behind the pyramid. So coming back to that diagram here. So when you are going from the external auditory canal downwards, you first encounter the tympanic membrane, and which is attached in the annulus in the tympanic sulcus. You remove it out, and from there you go in. Behind this pyramid, you have this facial nerve. Behind the pyramid, you have this facial nerve. Okay, so that was from above downwards. Now we are looking from the anterior wall. We are looking at the posterior wall. So it looks like this. From here, this looks like a rectangle. In the middle of it, you will have the facial nerve that is behind the bone, of course, and then you have the pyramid. The pyramid is present. The facial nerve is present just behind the pyramid. So what is he saying? At the junction of the medial and posterior wall, the tympanic or the horizontal segment of the facial nerve takes a lateral turn. It is turning laterally from medial to lateral. I have some good diagrams now. We will try to go well in this. Now, if you are looking at the medial wall of the middle ear, where this is the promontory and this is the facial nerve, it comes like above. You have to understand it's coming towards you. It is coming towards you laterally, from medial to lateral direction. It is coming towards you. Okay, and it passes through the posterior wall of the middle ear to come out to the stylomastoid foramen. So it descends vertically behind the pyramid, and is called this is called by three names. One is the vertical segment, or the descending segment, or the mastoid segment of the facial nerve. Why we call it the mastoid segment of the facial nerve? Because here is where we encounter, while doing mastoidectomy, we encounter this facial nerve. So it's called the mastoid segment of the facial nerve. So this was another important structure on the posterior wall. The first structure is the adytus, which is connecting the attic with the antrum. Now, second one is the facial nerve. Third one is this brown structure that is present here, is called the fossa incudus. Fossa incudus is nothing but a depression, okay, in which the short process of the incus is more blunt. So short process of the incus gets attached to this fossa incudus. So fossa incudus is an important landmark when we try to do posterior tympanotomy approach, when we are trying to do a cochlear implant surgery. We will talk about it just after a few slides. So this is an important thing. Next important landmark. So the first is the adytus, second one is the facial nerve, third is the fossa incudus. So fossa incudus is just nothing but a depression on the posterior wall on which rests the short process of the incus. Now coming to the facial recess, or called the suprapyramidal recess. Frankly speaking, this is actually a nightmare for an undergraduate student, but when you start operating, you work in this facial recess area, then you will understand it. Unless you do it, you will never understand it completely. Okay, so facial recess. Facial recess is the area on the lateral part of the present on the lateral side of the vertical part of the facial nerve. Now coming through that same analogy that we were talking about, this is the pinna. From the pinna, you are looking into the external auditory canal, and then you come to the tympanic membrane. I think I'm clear till now. Just behind the tympanic membrane, obviously, this is the epitympanum, this is the mesotympanum, and this is the hypotympanum. Okay, so you have this medial, this is the middle ear, and this is the medial wall of the middle ear where you have the promontory. This is nothing but the posterior wall of the what we are talking about. Okay, in this posterior wall, now let us just focus on this segment. When you come here, you will see first you are going to encounter the chorda tympani. After that, there will be a depression. After that, there will be the facial nerve, the elevation, the bulge caused by the facial nerve. Then you will have a depression, and then you have the floor that is the medial wall. So this part that we are talking about, this recess, this depression that is seen from above downwards, very difficult to look at this area. So that is called the facial recess, which is present lateral, to the vertical part of the facial nerve. Okay, so coming to that diagram again. Coming to the diagram of the posterior wall, is like this. Okay, this is the additus from where the posterior wall is going into the antrum, and then this is the horizontal segment of the facial nerve. It is taking a bend called the second geno and going downwards. Okay, then you have the fossa incutis here. Okay, now from just before it exits the stylomastoid foramen, it gives off a branch called the chorda tympani nerve. Now this is the medial wall of the medial side of the posterior wall. This is the lateral side, that is towards the external auditory canal. So it gives this chorda tympani nerve. Okay, so this part of the posterior wall, which is present lateral to the facial nerve and medial to the chorda tympani and inferior to the fossa incutis, this part is called the fossa incutis. Inferior to the fossa incutis, this part is nothing but the facial recess. So if you look from above downward, this is the external auditory canal, posterior wall of external auditory canal. This is the tympanic annulus, and from there you will come across. First thing is the bulge of the chorda tympani, then it goes behind, and then there is a bulge of the facial nerve. Then the bulge of the facial nerve that is present above the chorda tympani. Here you have the pyramid. Okay, that is present on just above, on top of the facial nerve. You have the pyramid from which comes the stapedius muscle, right? So this part, that's why it's called the suprapyramidal recess. Suprapyramidal recess. It is called the suprapyramidal recess. It is present lateral to the facial nerve, medial to the chorda tympani, and superiorly it is bounded by the fossa incutis. Now, did you understand? So this part I am talking about now. So this part is nothing but the facial recess. This is nothing but called the facial recess, also called the suprapyramidal recess. So superiorly by the fossa incutis, laterally by the chorda tympani, medially by the descending facial nerve. So this part is again important. Now how did we come to this part? Now I will try to tell you how we came to that part. Now, to understand that, this part, so let me just remove this part so that I can again draw the diagram so that you can understand the orientation. Okay, you can understand the orientation. Now I am looking at a patient. I am suppose this is the operation table. This is the operation table, and I am sitting here, and the patient is lying down here. And this is the head of the patient, but he is facing that side. His face is that side. This is his ear. This is his right ear. Okay, his face is looking that side. These are his eyes. This is nose that is looking at. So the right ear is up. Right ear, that is I want to operate this ear. It is up now. Okay. Now I want to focus on the area where I want to operate. So this is the external auditory canal. Okay. Behind it is the mastoid. Okay. Behind it is the mastoid. So this is the posterior wall. That is the wall in between the middle ear and the mastoid. So that is what I am trying to look at now. Now after I do that, what do I do? So I have come to that area where I want to operate. I have already now the external auditory canal. This is the mastoid. I start drilling at this area, which is called the McEwen's triangle. I start drilling. All this part of the bone I have removed. So now we have the external auditory canal and we have the cortical mastoidectomy that has been done. Cortical mastoidectomy, it has been done. I have not removed this part, posterior wall of the external auditory canal. So this posterior wall of the external auditory canal, if we look at it from posteriorly, it will appear like this. That cortical mastoidectomy that I talked about, it looks like this. So this is the posterior wall of the external auditory canal. From there is the external, that side is the external auditory canal. So this is just nothing but a wall. This is a wall. Okay. and on that side of the wall you have the external auditory canal. So here we have delineated it, and we have opened this part. Here through that we can see the vertical part of the facial nerve going down. From in that wall above superiorly we can see the chorda tympani going above, and from there it will go through the medial wall attic area to come out to the canal of Hugier. In the superior part of this posterior tympanotomy, this is called a posterior tympanotomy. Posterior tympanotomy. Posterior wall, you are opening into the middle ear. Here somewhere is the tympanic annulus. Okay, so this is the pyramid. From the pyramid comes the stapedius tendon, which is attached to the neck of the malleus, and here is the round window. Through this you can insert the cochlear implant electrodes. Okay. This is the fossa incudus. So, facial recess is bounded inferiorly, also called medially by the facial nerve, laterally by the chorda tympani, superiorly by the fossa incudus. Above you will have this antrum. You have this additus. From this is antrum, additus. And beyond you will have the lateral semicircular canal and the posterior semicircular canal in the floor of the cortical mastoidectomy. Okay. So this is the facial recess. Applied anatomy. When do we open the facial recess? When there is a minimal disease in the mastoid, minimal disease because of a cholesteatoma, and you do not want to remove the posterior wall. If you remove a posterior wall, it will become a modified radical mastoidectomy, where the entire external auditory canal and the mastoid will become one single cavity. Okay, will become one single cavity. So external auditory canal and the mastoid will become one single cavity. So we don't want to do that. We want to give as normal anatomically to the patient as possible. You keep the posterior canal wall intact, and you go through this posterior tympanotomy into the middle ear. This is the middle ear. Okay, and through the middle ear we try to remove whatever cholesteatoma. Through this additus we try to remove as much cholesteatoma. You remove all only if it is minimal, and you can be sure that you are removing the entire cholesteatoma. Try to do this approach. Okay, cochlear implant. We use this posterior tympanotomy to do the cochlear implant surgery also. Coming to sinus tympani. What is sinus tympani? Now coming to sinus tympani, it is also called the infrapyramidal recess. This is the area medial to the bulge of the vertical part of the facial nerve. Now coming to the same diagram here. This is the posterior wall. As I said, this is the bulge for the chorda tympani. Behind it you have the facial recess, and then you have this bulge for the facial nerve. Here you have the pyramid. The depression that is present below the facial nerve bulge is called the sinus tympani, also called the infrapyramidal recess. This is the most common place where the cholesteatoma will get remain. Where the part of the cholesteatoma you cannot remove completely. This is the most common place for residual cholesteatoma. Okay. Now coming to the boundaries of cholesteatoma, it bounded above by the ponticulus, below by the subiculum. What is ponticulus and subiculum? Ponticulus and subiculum are nothing but bony ridges which are extending from the promontory to the posterior wall. So this diagram, I'll again draw it here. Suppose this is the promontory and this is the facial nerve, horizontal segment of the facial nerve going, and then it will become the lateral, become the vertical segment of the facial nerve. Here you have this pyramid coming out. This is the promontory. Then this is the oval window. From the promontory, you will have a ridge of bone which is going posteriorly. The superior ridge is called the ponticulus. Now this is what I am talking about. This one. Okay. The above one is called the ponticulus. This one is called the ponticulus. Yeah, this one is called the ponticulus. There is a ridge of bone that is coming from the promontory going back towards the posterior wall, and there is another ridge of bone that is going from the promontory to the posterior wall. The lower one is called the subiculum. The recess that is present in between the ponticulus and the subiculum, which is present medial to the bulge of the facial nerve, is called the sinus tympani. This is the hidden area and the most common site of residual cholesteatoma as we described. So again, this is an important thing. Again, let me put the same analogy. So you have the external auditory canal from the, this is the pinna, external auditory canal, you come to the tympanic membrane, and in the posterior wall first thing that you will see is the facial recess. Chorda tympani and then the facial recess, and then you will see the facial nerve and the pyramid. Below that, the depression that is present is called the sinus tympani. If you look at it from the medial wall, if this is the promontory, from the promontory you have one ridge of bone going above. The superior ridge of bone is called the ponticulus, the inferior ridge of bone is called the subiculum, and here you have that bone will be there, the vertical part of the facial nerve. Underneath that you will have the fascia, you have the sinus tympani. Okay, I think this is clear, but you will have to go through again. Now coming to chorda tympani entry. Okay, vertical part of the facial nerve exits the temporal bone to the stylomastoid foramen. Okay, we talked about this. The horizontal segment of the facial nerve, second genu, vertical segment of the facial nerve comes out to the stylomastoid foramen. From the stylomastoid, exits the stylomastoid foramen 4 to 6 millimeters from the exit. It gives a branch called the chorda tympani nerve. It is going through the bone only. Okay, then through the posterior canalicus it enters the middle ear, and in the middle ear it passes in between the head of the neck of the malleus and the body of the incus to exit through the canal of Fugger. So it gives taste sensation to the anterior 2/3 of the tongue. It gives taste sensation to the anterior 2/3 of the tongue. You are looking, this one is the posterior wall, the chorda tympani, when we are looking through the posterior wall. The same thing if you're looking from the medial wall, looking at the tympanic membrane. Tympanic membrane, the medial surface, this is the medial surface of the tympanic membrane. So this is the vertical part of the facial nerve. You give the tympanic nerve is given here, and it goes to the bone, and from the posterior canalicus it enters the middle ear, passes in between the neck of the malleus and the body of the incus to come out through the canal of Fugger. Okay, so this is the chorda tympani nerve entry point. Now coming to medial wall. So we just covered the posterior wall. We'll have a recap at the end of this presentation, but now this is the medial wall. So medial wall is a common wall between the middle ear and the inner ear. So if you look at it, suppose this is the medial wall of the middle ear. Here you have the inner ear. You have the bulge of the basal turn of the cochlea, causing the promontory. So this is the common wall between the middle ear and the inner ear. Okay, there are 6 important structures on the medial wall of the middle ear. The first important structure is called the promontory. The promontory is because of the bulge in the center. This bulge that you can see in the center is the promontory, which is caused by the basal turn of the cochlea. On the promontory is present this nerve that is called the tympanic plexus. This tympanic plexus is formed by the tympanic branch of the glossopharyngeal nerve and the sympathetic fibers from around the internal carotid artery. Yeah, we talked about the internal carotid artery, right? We talked about the internal carotid artery in the anterior wall. Internal carotid artery, it is going outside. It has a sympathetic plexus on its wall, and the tympanic plexus enters the middle ear cavity. It anastomoses with the tympanic branch of the glossopharyngeal nerve to form the tympanic plexus. So what does this tympanic plexus do? The entire sensory innervation of the entire middle ear sensory supply is by the tympanic plexus, and also gives secretomotor fibers to the parotid. Okay, processes cochleariformis. What is the structure that is present anterosuperiorly? So again, orienting yourself. This is the medial wall of the middle ear. This is the promontory. This is the opening of the eustachian tube. As we said, in the anterior wall, above the opening of the eustachian tube, you have the canal for tensor tympani. From the canal for tensor tympani comes the muscle for tensor tympani. Then you have the tendon for tensor tympani. This part, that is like a hook-like structure. The tensor tympani, the tendon for tensor tympani hooks around this. This is the canal for tensor tympani, and it passes medially, and around this processes cochleariformis, it hooks and starts traveling laterally to get attached to the neck of the malleus. Okay, that is the tensor tympani muscle. So this is the canal for tensor tympani. It's a hook-like structure present anterosuperiorly on the medial wall. So this is the anterosuperior part of the. This is the superior part, this is the anterior part, this is the posterior part, this is the inferior part. So in anterosuperiorly, the structure that is there is called the hook-like structure that is present, around which the tendon or the tensor tympani hooks around, is called the processus cochleariformis. Okay, Why is it so important? When you start doing a mastectomy, you want to know where is the facial nerve. The most important structure when you do a mastectomy is the facial nerve. You want to know where is it. So it acts as a landmark for the first genu of the facial nerve. The facial nerve, after coming from the inner ear, it bends like this. Okay, this is called the first genu, and here starts the middle ear, and then it turns and becomes the horizontal segment of the facial nerve. Then it has a second genu going in the vertical part, posterior wall, forming the vertical or the mastoid segment of the facial nerve. So first genu lies above the processus cochleariformis. So this is the facial nerve. This is the processus cochleariformis. So this is the processus cochleariformis. The first genu will be here. This is the first genu. It bends almost at more than 90-degree angle. This is the first genu. So you will know where it is. If you can find out where is the processus cochleariformis, you will know where is the first genu. From there you can trace the horizontal segment of the facial nerve, and from there you can go to the second genu. And this is the posterior wall. It is becoming the vertical segment of the facial nerve. Coming to the bulge of the lateral semicircular canal, what is the structure that is present on the medial wall? Another important structure is called the bulge of the lateral semicircular canal. It is present at the most posterior superior portion of the medial wall. So this is the superior part, inferior part, anterior part, posterior part. This one that we are talking about is the bulge of the lateral semicircular canal. It is like an ivory kind of bone that we see when we do a mastectomy. Again, what is the importance of this lateral semicircular canal? Once you have found out where is the lateral semicircular canal, the facial nerve, the second genu, and the horizontal segment of the facial nerve is just and anterior-inferiorly to the lateral semicircular canal. Okay, just below that you have the oval window on which is present the stapes foot plate. Okay, so bulge of the lateral semicircular canal is present on the most posterior superior portion of the medial wall, just above the horizontal, the tympanic segment of the facial nerve. So if you find the lateral semicircular canal, then it means that the facial nerve is right below it. Oval window. Oval window lies posterior superiorly on the medial wall. Oval window lies posterior superiorly. The foot plate of the stapes overlies it. As I said, the oval window is covered by the foot plate of the stapes. Okay, oval window lies inferior to the horizontal segment of the facial nerve. So this is the horizontal segment of the facial nerve. Okay. The posterior superior part most posterior superior part you have the lateral semicircular canal, and then posterior superior part of the medial wall you will have the oval window with the foot plate on it. So in between these two is the facial nerve. So these two acts as landmarks to identify the horizontal segment of the facial nerve. So these are important landmarks. Round window. Posterior inferiorly. So this is the inferior superior part, posterior anterior part. Posterior inferiorly you will have the oval window which is covered by the secondary tympanic membrane, and this entire part you will call it as the round window niche. It is covered by the secondary tympanic membrane. Okay, now coming to facial nerve. Facial nerve of the horizontal segment on the medial wall. So this is the entire facial nerve diagram. This is a motor root, this is the sensory root, both of them are joining. This is the intracranial part, and there it enters into the internal acoustic meatus, and that we call it the meatal segment. Before it enters into the middle ear and becomes the horizontal segment, you have the first genu, and this becomes the horizontal segment of the facial nerve that is present on the medial wall of the middle ear. Then you have the second genu, which is and from there it becomes the vertical segment of the facial nerve. These are the various branches. When we talk about facial nerve, we'll come in depths about it. From the first genu there is a branch called the greater petrosal nerve, greater superficial petrosal nerve. So facial nerve coming from the inner ear enters the middle ear on its medial wall, where it takes a turn called the first genu. So that's the same thing that I told now. When it's coming from the internal acoustic meatus, this is the middle ear, where it is entering the middle ear. That sharp bend, genu means knee. Okay, genu means knee. It takes a knee kind of a bend here. From there it is given the greater superficial petrosal nerve. Okay, that is not important here. So it gives this segment is called the first genu, and from there it enters and becomes the horizontal segment of the facial nerve. What is the landmark for the first genu? Just below it you will have the processus cochleariformis hook, which this tensor tympanic tendon will hook around it to get attached to the neck of the malleus. Okay, then it continues horizontally backwards towards the posterior wall as the horizontal or the medial segment. So let us have a quick recap of the 7 important structures on the posterior wall. So posterior wall, if you're looking at from the anterior wall, appears like a rectangle. At the superior part, you will have the adytus. Adytus is communicating the middle ear to the antrum. Then just below it, you'll have a depression called the fossa incudis, in which is there the short process of the incus. It is attached to the fossa incudis. Fossa incudis forms the superior boundary of the facial recess. Then you have the horizontal segment, which is becoming the vertical segment of the facial nerve, which is passing through the posterior wall. This is the vertical segment of the facial nerve. On the posterior wall, you will have a pyramid. You will have a bony projection that is called a pyramid. The facial nerve will lie right under the pyramid. Okay, from the pyramid you will have the stapedius tendon. Okay. Then what do we have? Just before it exits the stylomastoid foramen, it gives a nerve called the chorda tympani nerve. This chorda tympani nerve will continue forwards in the middle ear that we talked about. Now this part that we see, which is present lateral to the facial nerve, is called the facial recess. Why is facial recess important? Facial recess is important because you do a posterior tympanotomy approach. You enter the middle ear through this opening, and what are the boundaries of the facial recess? Laterally you have the chorda tympani, medially you have the facial nerve, and superiorly it is bounded by the fossa incudis. This part is the facial recess. You can enter into it and remove any cholesteatoma, and also cochlear implant surgery is done through this posterior tympanotomy. Medial to this, let me draw again. This is the facial nerve. Okay, this is the facial recess here. This is the chorda tympani. Here you will have, from the medial wall, you will have two projections of bone, ridges of bone that are coming toward the posterior wall. The superior one is called the ponticulus. The inferior one is called the subiculum. This part that is present which is present medial to the facial nerve, in between the ponticulus and subiculum, that becomes the sinus tympani. And why is sinus tympani important? Because it is a hidden area where this is the most common place where you will get residual cholesteatoma. Okay, so have we covered adytus? Yes. Fossa incudis, pyramid, facial nerve, chorda tympani, facial recess, and sinus tympani. Okay, now coming to the 6 important structures on the medial wall of middle ear. So this is the bulge of the promontory. Okay, then here you have the eustachian tube opening. Here you have the tensor tympani opening. Then you have the horizontal segment of the facial nerve. Okay, then this is the promontory, as we said. Yeah, anterior superiorly you have a hook-like structure through which this tensor tympani muscle becomes the tensor tympani tendon, and it curves around this processus cochleariformis, which is present in the anterior superior part of the medial wall of middle ear, to get attached to the neck of the malleus. If you can find this processus cochleariformis, it means that right above processus cochleariformis you have the first genu of the facial nerve. Okay, then what do we have? As the facial nerve goes behind posteriorly, it takes a turn called the second genu, and then it continues vertically as a vertical segment of the facial nerve. Above this horizontal segment of the facial nerve, posterior superiorly, you will have a bulge that is called the bulge of the lateral semicircular canal. In between the promontory and the facial nerve, on the posterior superior aspect, you will have the oval window, which is the foot plate of the stapes. Posterior inferiorly, you will have the round window, and with the round window niche. Okay, so have we covered the promontory? Yes. Processus cochleariformis is present anterior superiorly. Bulge of the lateral semicircular canal is present posterior superiorly. Oval window is present posterior superiorly. Round window is present posterior inferiorly in the medial wall. And the facial nerve horizontal segment, which after coming from the first genu continues forwards as the horizontal segment, then takes the second genu and continues forward as the vertical segment or the mastoid segment, coming out from the stylomastoid foramen. Okay, with this we have covered the posterior and the medial wall of middle ear. I hope I have tried to make this concept as simple as possible so that you can understand it and remember it, but I guess you will have to read it and reread it before you understand it completely. Thank you so much for the patient listening.